Welcome back once again to Where Your Health Matters with Elizabeth, where we provide you with the necessary tips to care for your health. Is there any diseases you're fighting? Is there any diseases you're going through? This is the right channel for you, where we give you tips on how to manage it nutritionally and how to stay healthy. The topic for today is a very interesting topic. It is a very interesting topic as well. It is very wide. It will take us a couple of months to finish this topic. Months to finish this topic. And the topic is drumroll. The topic is ulcer. Yes, ulcer. Ulcer is very wide. It's not just one that is common that everybody know about. Ulcer is a very wide topic, like very, very wild. Ulcer is a sore or open wound that doesn't heal easily and can occur in various parts of the body and causes tissue breakdown. Ulcers are usually painful and can cause bleeding, infection, or other complications if not treated properly. We have different types of ulcer, and we'll be talking about it in the order that is being listed. One, we have skin ulcer, which we'll be talking about today. Then we have mouth ulcer, be the next video, pelvic ulcer, genital ulcer, and eye ulcer. There are also some other ulcers that is not like as common as these 5 types. We have stress ulcer, tropical ulcer, and malignant ulcer. There are also different causes of ulcer. Ulcer can be caused by factors such as stress, poor diet, excessive alcohol consumption, smoking, and even infection caused by bacterium Helicobacter pylori. There's this misconception about ulcer that ulcer is caused by eating. People that eat sometimes add ulcer, especially pelvic ulcer. Yes, people that eat have it, and people that don't eat have it. So ulcer is not caused by not eating. Most times are caused by bacteria known as Helicobacter pylori, and can also be caused by other factors like stress, poor diet, excessive alcohol consumption, or smoking, and so many more. So now we'll be looking at skin ulcer. Skin ulcer is an open sore or wound on the skin that does not heal normally, or it keeps coming back. It forms when the blood flow is poor and when there is constant pressure or when injury damages the skin and underlying tissues. If untreated, it can become infected and even spread deeper into your muscles or your bones. There are different causes of skin ulcer. Poor blood circulation, either through venous or arterial diseases, constant pressure on the skin, especially in bedridden patients. Diabetes causes ulcer. It causes the nerve damage and poor blood supply. Infection, either by bacterial infection or fungal infection. So trauma also causes skin ulcer through cuts, burns, insect bites. Also immune diseases like vasculitis. It is an inflammation and damage to blood vessels. Cancer also causes skin ulcer, but it is very rare. But some certain skin cancer can also ulcerate. There are different types of skin ulcer. We have the venous ulcer, which is located mostly on the lower legs and the ankles and around the ankles. The main causes of venous ulcers is poor blood return through veins, poor blood pools, pressures builds or skin breakdown. How do you characterize the venous ulcer? It's shallow, irregular shaped ulcer. Skin around it is always dark brown or purple due to blood leaking into your skin. It is often painless unless it's infected. Swelling in the legs, and also it may ooze out fluid. The second type of skin ulcer is arterial ulcer. It is mostly located at your toes, your foot, your lower legs, especially over the bony areas. What are the causes of arterial ulcer? We have poor blood supply due to narrowed arteries, known as atherosclerosis. The characteristics that shows when you are suffering from arterial ulcers is you have a deep punched out appearance. It is very painful, especially at night or when the leg is elevated. Cold and pale feet, little or no bleeding from the ulcer. May also have weak or absent foot pulses. The third type of skin ulcer is diabetic ulcer. It's known as diabetic induced ulcer. You know that when you're suffering from diabetes, they used to tell diabetes patients that they should make sure they do not have any mud, and they should be very careful that they don't have any cuts, because it can lead to diabetic ulcer. The location of diabetic ulcer is bottom of the feet, especially under the toes or heels. What causes it? Combination of nerve damage and poor blood flow. What are the characteristics of diabetic ulcer? It's painless because of nerve damage, can become very deep before noticed, high risk of infection, can lead to amputation if untreated. So you have to be very careful if you have diabetes not to have any cuts or any injury at all. The fourth one is known as pressure ulcers. That is pesos. This happen in people that are sick for a very long time. They are always on one spot. Sick people, bedridden patients, they are always on one spot. Their sickness is worse to the point that they cannot stand up. So they also suffer from pressure ulcer. It can be located on the bony areas, especially your back, hips, heels, your elbows. Causes of it's prolonged pressure from lying or sitting without moving, like I said earlier, and it has different stages. Number 1 stage, redness without a break in the skin. 2, skin breaks open, forming a shallow sore. 3, crater like deeper ulcer. 4, exposes muscles or bone, that is veins in a very serious case. And there are also risk for pressure ulcer. 1, immobility, paralysis and coma. Those are the main causes, the risk factors of having a pressure ulcer. And elderly people also. When you are old, you tend not to have the energy to move around when you're young. So you are at risk of developing pressure ulcer at a point. Severe illness, you may suffer from illness that do not make you move around. Also, we have another type of skin ulcer, which is known as infectious ulcer. It is caused by either bacteria, fungi, or parasites. The bacteria caused ulcer is Staphylococcus aureus or Streptococcus infection. Fungi, especially in tropical climates or immunocompromised people that their immune is compromised, they are suffering from one illness or another, like HIV, like this, we are at risk. Parasites. Leishmaniasis causes skin ulcer in some countries. While the last type of skin ulcer is known as malignant ulcer. Skin cancers like squamous cell carcinoma or basal cell carcinoma can appear as non-healing ulcer. That's another malignant. There are several symptoms to look out for in skin ulcer. 1, open sore that doesn't heal, pain or tenderness, especially if it's infected, redness or swelling around the ulcer, discharge like clear yellow or pus if it is infected, bad odor if it is infection caused ulcer, you experience bad odor, blackening tissue, in several cases it's called necrosis, fever if infection spreads to your blood. How do you diagnose skin ulcer? Skin ulcer can be diagnosed through different ways. Either from physical examination, they will look at the location of the ulcer, the skin, the depth, and the appearance. They also go for blood tests where they check if you have diabetes, infection markers, anemia. Swab test fluid from the ulcer for bacteria or fungi. Doppler ultrasound to assess blood flow in legs. Biopsies to rule out cancer if the ulcer looks suspicious. How do you treat skin ulcer? Treating skin ulcer is of different steps. Skin ulcer depends on the cause, but there are general steps which include cleaning the wound, gently cleansing daily, removing dead tissue can help in treating skin ulcer. Infection control, using antibiotics if infection is present, either through oral or topical. Dressing, specialized bandage like foam, hydrocolloids, anginate dressing is advised. Improve circulation by compression stockings for venous ulcer, surgery for blocked arteries. Also, you can also improve circulation through good control of diabetes, hypertension, heart diseases, and also relieve your pressure through regular repositioning, like change position, special mattresses for those suffering from bed sores. And lastly, through surgery. In some severe cases, skin grafts or vascular surgery are needed in treating skin ulcer. Now we'll be looking at the complication of untreated skin ulcer. Severe infection can be caused if you leave your skin ulcer untreated. Cellulitis, bone infection known as osteomyelitis can be caused. Sepsis is a life-threatening spread of infection. Amputation, especially in those suffering from diabetes and the nerve ulcer, diabetic ulcer can amputate it if it's left untreated. Cancer development, it is rare but it is possible if you leave your skin ulcer untreated, can develop cancer also. How do you prevent skin ulcer? 1. Through good skincare and hygiene. 2. Control chronic illness like diabetes, vascular diseases. Avoid prolonged pressure. Move and change position often. Like try and move and change position often. Proper foot care, especially for those suffering from diabetes. Use compression therapy if you have venous problem. Also eat healthy diet that is rich in protein, vitamin C, vitamin E, zinc for skin healing. Now we'll be looking at how to manage skin ulcer through nutrition, the nutritional management for skin ulcer. Mediterranean diet. Mediterranean diet is rich in fruits, vegetables, healthy fats, and lean protein. Fiber-rich food also ensures adequate fiber to prevent constipation, which can affect mobility and pressure ulcer. So these two diets is mostly recommended for those suffering from skin ulcer. The most recommended diet for those suffering from skin ulcer is Mediterranean diet or fiber-rich diet. We're looking at the food to eat. Your protein intake. Your protein is very essential for tissue repair and immune function. So you opt for high quality protein sources. Sources like lean meat, fish, eggs, dairy products, legumes, tofu. Sometimes protein supplements can also be considered if your dietary intake is insufficient. Protein supplements like whey, casein. The key vitamins and minerals we have to look at for. Vitamin C is crucial for collagen synthesis, and we have different sources of vitamin C like your citrus fruits, your strawberries, your bell peppers, and also you can opt for supplements if they're deficient, but make sure you avoid too much of it to prevent diarrhea. Vitamin A supports epithelial tissues, and sources are carrots, sweet potatoes, spinach, and supplement also, but you have to be conscious when taking vitamin supplement to avoid high doses. If you are pregnant, avoid high doses. Zinc is also important. Supplements can be recommended if deficient, but too much of it can interfere with other minerals. Sources are meat, shellfish, and nuts. Amino acid like arginine, glutamine can also help in skin ulcer treatment. Arginine boosts nitric oxide, improving blood flow. Sources are turkey, peanuts, soybeans, chicken. Glutamine is a fuel for immune cells and intestinal health. 10 to 20 grams per day is recommended, and you can find it in your meat like beef, your chicken, your dairy products, your fish. Omega-3 fatty acids have anti-inflammatory properties. Your sources for it is fatty fish like your salmon, your mackerel, your sardine, your flax seeds, your walnuts. Staying hydrated is also very important when you have skin ulcer. Dehydration can impair your healing, so adequate fluids from water, your herbal tea is very important. Take up to at least 8 to 10 cups of water per day. Calories are necessary to prevent the body from breaking down muscles. If undernourished, increasing calorie intake with healthy fats like avocado, nuts, olive oil helps in preventing muscle metabolism. Glycemic control for diabetic ulcer. You emphasize mostly on low glycemic food. Eat more of low glycemic food, especially if you have diabetic ulcer. low glycemic foods like whole grains, your not starchy vegetables, your fiber, and also make sure you monitor your blood glucose every day. For special consideration, pressure ulcer focuses on protein mobility and pressure relief for those suffering from pressure ulcer. So those suffering from venous ulcer, you reduce sodium to manage edema, reduce your salt intake. Also, you collaborate with your dietitian to analyze your own diet for you. In any of the ulcer that you're suffering from, meet with your dietitian or your nutritionist so they will personalize the diet that works best for you in treating your skin ulcer. Also, you have to avoid some foods like alcohol, smoking. Make sure you avoid them as they impair your healing. Avoid excess sodium and refined sugar. That changes is also important in managing skin ulcer. You manage your weight, avoid smoking, like avoid it totally, and also you go for regular wound assessments and also adjust your nutritional plan based on your eating progress. As I said earlier, meet with your dietitian to modify the kind of diet that best suits you. And this is a wrap on where your health matters with Elizabeth. I hope you've learned one or two from this video, and see you next time for the continuation of this particular topic. Bye.